Welcome back. It is my pleasure to introduce you to Leeya Alperin, an amazing 20-year-old woman diagnosed with generalized lymphatic anomaly and an advocate for patients with rare diseases and their families. The title of her talk is Fight Song, the Patient as an Advocate. Welcome, Leeya. I greatly appreciate you sharing your journey as a patient and as a rare disease advocate. I'd love for you to tell us a little bit about more about who you are, and how you became involved in advocacy at such a young age.
Thank you so much for that introduction, Mike. It was almost 5 years ago when I was diagnosed with GLA, and actually advocacy for my family and I almost started immediately. We were at Le Children's Hospital for almost a month, and shortly after I was diagnosed. And while we were at the hospital, we had to advocate for for me and stuff while we were there, just for little things just in the hospital, such as making sure I had the right compression socks and all these things, because having a teenager that needs those things wasn't always common, and so it was harder to get those things, and it took longer to get things like that, so we had to push for it. But then also at the same time, the hospital and the doctors and nurses were also great advocates, and they also really wanted to help, so that was great to have as well. And shortly after I was discharged and stuff, they actually asked my family and I to be part of the Family Partners Council there. And so that really started our advocacy journey as a whole family, where we could lend a hand and lend our voices on things that we thought that things could improve on as the hospital as a whole. And after that, like a year later, we went and with Le Bonheur and advocated on Capitol Hill. And that was such an incredible opportunity because I learned what my voice could do, what my experience could do to share with no matter what party you are on, how everyone could come together for children and for rare diseases, because you just want to help these kids, help them grow, help them be able to get the treatment that they want, no matter what hospitals they have to go to. And that was just so incredible to see. And then when I was told a few weeks later that, we got a few people to sign on to one of the acts that we were advocating for, that was the moment that I was like, wow, like we did that. Like we can actually make change. And that's what really like kickstarted, I think, everything for me. And that was in 2018 was when we advocated on the Hill for the first time with Le Bonheur. And that's when like kind of my advocacy journey was really like, we could do this. Like, and my whole family was like, wow, like we could actually make change. Like our voices can be heard. And when it comes to healthcare, things aren't necessarily as divided as people might think they are. And that's kind of what really, like I said, like what really started it and stuff. And I really loved that. And I've always had a passion for helping people and how to care for people. And this just pushed it even more and made me want to help people even more, and made me want to use my experience and what my family and I have been through to help people, to improve things, and to also learn from others, learn about other people's experiences, to keep improving things. Just within 5 years of being diagnosed, I've already seen so much good, how doctors can communicate better, how just my doctors here are communicating better with one another. And I just know that we can become even stronger and even better and make things easier for all of us in the future.
That sounds like again, a terrific experience. And I think that how apropos for a patient voice session, right? I mean, you found your voice, and you not only advocated for yourself, but you really discovered that through your voice, you can advocate for others, not only with the same disease, but with other rare diseases as well. So that is fantastic, Leeya. I can't tell you how important that is, not only to our patient community, but also to the rare disease community at large. So Leeya, you did have some formal training in advocacy, Every Life Foundation. Can you elaborate on that and tell us how that really helped shape your ability to advocate for yourself and for the rare disease community?
Yeah, so the Every Life Foundation, I didn't even know this foundation even existed until actually I don't know who it was in the LGDA support group who even posted about it, but that's how I even found out about it, which shout out to the support group because that's how I find out about a lot of these cool things. Um, so I found out about it through them, and I applied to this group, and I was like, this is something that I'm very passionate about, and I would love to just keep learning. And this leadership academy that sorry, not the LGDA support group, that the Every Life Foundation did was just incredible. It's a total of 6 sessions that they did, and each session was 3 hours long. It was on Zoom. It was a little time consuming, but it was so worth it. And each session, like, they had different people from all different groups, some from the FDA, um, some from the DoD, like all different groups that came and talked to us about all different things that you can do as an advocate or you could do as a career wise. We learned about drug regulation, all these different things that I had no idea about. And it was honestly really incredible to learn how much more that like our voices can be heard, but also like how much more that like I'm trying to like formulate my words best. um, but also like just in general, like as a leader, if you are advocating, you don't necessarily have to be like a lobbyist or do these certain things, but you can just be a leader in general. But you could be a leader in different aspects. You could be a leader within the FDA, but you could be like a volunteer aspect. You don't necessarily have to work with the FDA. You could just be a volunteer who goes through the process with the people who are doing the trials. You're going through it with them. You're kind of being their guideline through it. You're supporting them through it. You don't have to necessarily work for the FDA. And just like all these little things that like we learned with it was really cool. And I was like, wow, like I could do all these little things like on the side, like not necessarily as part of my job in the future. I could just do it on the side. And I think that was just so cool. And then then a few months later, when we advocated for Rare Disease Week, I was able to use all that information that I learned to help advocate with the Tennessee congregation that I was a part of because I'm from Memphis. So I was part of the Tennessee delegation and for Rare Disease Week, and I was able to use like my skills and my knowledge to advocate um, for one of the acts that some of the other people didn't know a lot about. So I was able to advocate for that act, and I was in charge of advocating for the SAT Act. If you guys don't know what that is, and that one deals a lot with the FDA and stuff. And I was able to use my knowledge that I learned with the Every Life Foundation. And so that was just a really cool experience. And I learned a lot of leadership skills. And because of what I learned there is the reason why like I now have more public advocacy pages as well. Because I want to share my story more on a public platform. I used to have like a separate private Instagram account that I could just share with family and friends, like close family and friends, different than like my regular Instagram. And this like was like, more private and stuff that I could just share give updates on my story, but I made it public after doing the Every Life Foundation because I wanted to really share my story, make people realize that they're not alone, but I also wanted to advocate along with it and, share the story, but also be like, I might not look like I have a rare disease. People look at me all the time, sometimes when I have to use my handicap tag, and they look at me weird. And I'm like, you don't know what I deal with on a daily basis. You don't know why I have to use this today. And so I like little things like that. Like I'm trying to get out there and advocate for it. And it's been really nice that people can feel like that they can reach out to me now.
That's fantastic. And I think what I hear in this story is that, you can, there are many opportunities to advocate both for yourself and for others in the rare disease communities. And I think really opening the door to allow people to understand what those opportunities are incredibly critical in order to get our patients really advocating for them and for others within the community. So I appreciate that.
And I think, sorry, Mike.
No, go ahead. Go ahead.
I think also like that was one thing that I remember talking about in the Leadership Academy. Was one thing that I learned really important was balancing that, like advocating for yourself while advocating for everyone else, was balancing that, because you want to help yourself, you want to help your community, but you also want to help everyone else. And being able to balance those two things are kind of hard sometimes. So like learning how to do that was really important for me, because I knew that I wanted to expand my advocacy knowledge and everything. So learning how to balance that was really important.
Fantastic. And I think that's probably a lifelong journey. And we all struggle with that, in various forms or another. So I really appreciate that. So for the last minute or so, what would you like our patient community, clinicians, and researchers to know about the importance of advocacy?
That like clinicians and everything, love you guys, but as patients, we know our bodies, we know ourselves, and allow us to speak up, allow our voices to be heard, because we will respect you when you admit that you don't know everything about the disease, that you need to talk with other people. That's how you gain our respect for the most part. I know that's how how my doctors gained a lot of my respect, when they told me that they had to, talk with other people and then they'd get back to me. Because admitting that you don't know everything is so important, especially I think as a doctor, because you see being a patient with a rare disease, you see so many doctors and you see so many doctors that think they know everything. So seeing a doctor that thinks that they don't know everything is actually really nice to see. And they want to hear us. They want to hear our opinions on things. They wanted us to be a part of every step. Like my doctors, they'll walk us through the whole MRI and everything. They want us to be included. And I think that's so important, especially when you have a rare disease, is that we are included on everything, and that you want to make sure that our voices are heard. And I think that that's something that I hope that everyone got away from this, is that you need to stand up for yourselves a lot of times, and that we are not all the same. We might have the same conditions and stuff, but we are all not the same. Everyone reacts differently to everything. Everyone's condition is different in them. So, yeah.
Well, thank you, Leeya. I think that's a really important point, is that just because you have a disease that others have doesn't mean that you're the same as the next person. So, and advocacy is an important part of promoting yourself, but also those others that have rare diseases. So I really appreciate you sharing your compelling and very motivating story, and wish you the best of luck on your study abroad in the UK.
Thank you so much. And again, if anyone feels like that they ever want to reach out or learn more about the Every Life Foundation or anything, just feel free that you can reach out anytime.